There is no magic trick for getting pregnant quickly. Despite what some people might tell you, there's no specialty, or herb, or vitamin, or body treatment that can ensure you get pregnant on the first try. The best you can do is make sure you're healthy and you're having sex at the right time of the month. To that end, here are some tips. 1. Know your cycle. Figure out when precisely you are ovulating by temping and or using ovulation prediction kits. Make sure you're producing fertile cervical mucus. Make sure there are at least 12 days in between ovulation and the beginning of your next period. Make sure your temperature rises after ovulation and stays up until your next period. Consult a doctor if anything is wrong. 2. Have sex at least every other day in the week before you expect to ovulate. And continue to have sex every other day until you have confirmed ovulation, at least 3 days of elevated temperatures. Do not go more than a week without having sex the rest of the month. There is some evidence that sperm will be in peak condition if you have sex regularly. 3. If you need lube, make sure it's a sperm-friendly one like Pre-Seed. 4. There isn't really any hard evidence that lying still with your hips elevated after sex for 15 to 30 minutes helps, but it won't hurt. Likewise, there's no hard evidence that any particular position is better than any other. But it wouldn't hurt to use positions that permit deeper penetration, so ejaculation occurs as close to the cervix as possible. 5. Eat well and correct any nutritional deficiencies. If you're normal weight, do not diet. 6. If you have a thyroid condition, particularly hypothyroidism, consult your doctor. Your medication levels may need to be altered to be optimal for pregnancy. 7. Both of you need to avoid hot tubs and steam rooms. 8. Neither of you should use pot at any point in your cycle. It damages sperm, and while it does nothing to the female reproductive system, it affects the sperm once they're in there. Limit alcohol use. 9. Stop hormonal birth control as soon as possible. Even if you don't plan on trying for a few more months, you can still use condoms. 10. If nothing is obviously wrong, but you haven't gotten pregnant after a year of trying, if you're under 35, or after 6 months if you're over 35, consult a doctor. If something is obviously wrong, you're not ovulating, or you're not producing fertile cervical mucus, or your luteal phase is too short, etc., consult a doctor right away. 11. Try not to stress out. But don't worry if you are a bit stressed. Unless your level of stress is extreme, it is unlikely to affect your fertility. A gynecologist friend of mine actually told me that many couples could stand to be a bit more stressed. It keeps you vigilant and ensures you're doing everything you should be doing. Also, it won't necessarily help you get pregnant, unless you have some nutritional deficits, but begin taking folic acid and a prenatal vitamin as soon as you decide to start trying. Even if you're not going to start trying for a couple months. For maximum pregnancy benefits, ideally you will have been taking these for a couple months before you actually get pregnant.